Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Leading NP expert Dr. Margaret Fitzgerald shares her knowledge and experience to help you dissect the anatomy of a test question, so you can better understand how to arrive at the correct test answer. So if you're ready, let's jump right in.
A 76-year-old man with a 20-year history of hypertension presents for a sick visit in the primary care setting, stating, quote, "I don't think that new medication agrees with me," close quote. Until recently, his blood pressure was at goal with an ARB, angiotensin receptor blocker. But about 1 week ago, due to continued elevated readings, a second blood pressure medication, a thiazide diuretic, was added. Which of the following is most likely to be reported by this patient? A, since I started on the medicine, I passed out and woke up on the floor 4 times. B, about 2 days after I started the new medicine, I started feeling lightheaded when I stand up quickly. C, after starting the new medication, I feel like the room is spinning around me. D, I've had chest pain and sweating off and on since I started the new medication. The correct answer is B, about 2 days after I started the new medicine, I started feeling lightheaded when I stand up quickly. Where should you start with this question? First, determine what kind of a question this is. Given we're information gathering about a med adverse effect, this is an assessment question. Let's take a look at some background information. We're told that for a number of years, the patient's blood pressure was well managed with a single medication. Well, we're not told factors that might have influenced his rise in blood pressure. One non-modifiable factor, the patient's advancing age, could be implicated. In other words, as individuals age, the pipes tend to get stiffer. In other words, the arterial bed, the vessels are more constricted, blood pressure rises, and additional BP medications often need to be added. In this case, consistent with the recommendations of JNC8 and the ACC-AHA, an appropriate add-on med would be a thiazide diuretic. Indeed, this drug class is used in nearly everyone who is being treated for primary hypertension. In other Q&A podcasts, you've likely heard me say that common diseases occur commonly. I'm going to switch that up now and advise common adverse drug effects occur commonly. One of the most common adverse effects from thiazide diuretic use is lightheadedness, particularly with position change. The reason for this is multifold and can result from the medication's mechanism of action, where it modestly reduces circulating volume via sodium and water offloading. That's also how it lowers blood pressure. Usually this adverse effect can be managed via dose adjustment. Like sometimes what you need to do is pull the dose back a little bit, or simply time, as the lightheadedness often passes after a week or two of thiazide diuretic use. Older adults, in particular when taking any kind of a diuretic, should be advised to change position slowly to minimize the development of the symptom. Truth be told, you start a thiazide diuretic on a 40-year-old, they're unlikely to have the lightheadedness. You start it on a person in their 70s, like this man is, you're more likely to hear that. Of course, the NP must work with the patient to gather enough information about this problem to make a wise clinical decision by recognizing a new complaint that is likely not attributable to the new medication. At the same time, he's reporting one of the most common adverse effects to early thiazide diuretic use. Let's take a look one more time at the question and the offered response. A 76-year-old man with a 20-year history of hypertension presents for a sick visit in the primary care setting, stating, quote, "I don't think the new medication agrees with me," close quote. Until recently, his BP was at goal with an ARB, but about 1 week ago, due to continued elevated readings, a second blood pressure medicine, a thiazide diuretic, was added. Which of the following is most likely to be reported by this patient? Before we go any further, remember one of the first statements in this question was, he's saying, "I don't think the med agrees with me." So he's telling you something's going on since I started to take this med. All right, let's go back and take a look at the responses. A, since I started on the medication, I passed out and woke up on the floor 4 times. This is incorrect and clearly a very worrisome scenario because this describes syncope. And what is syncope? It's defined as a transient loss of consciousness characterized by a loss of postural tone, typically sudden in onset with no warning and with spontaneous recovery. And what he's describing is, I pass out, wake up on the floor. Like, in other words, he doesn't remember going down. The causes of syncope are varied, but can include cardiac outflow tract obstruction, such as seen with hypertrophic cardiomyopathy and high-grade aortic stenosis. Other reasons can include potentially lethal cardiac rhythm disturbances, like runs of symptomatic ventricular tachycardia. This syncope is not a common adverse effect seen with thiazide diuretic use. This is not the correct answer, and indeed is an incredibly worrisome situation. Option B, about 2 days after I started the new medicine, I started feeling lightheaded when I stand up quickly. This, of course, is the correct answer. The timing of the onset of the symptoms is telling, given that it's 2 days post-thiazide diuretic initiation is around the most common time for the lightheadedness to start. Remember what I just said a few minutes ago, how this could be addressed is by having him change position carefully and then either pulling back the thiazide diuretic dose if the symptom is really very problematic. Certainly could consider discontinuing the thiazide diuretic and using a different medication. Or if it's not bothering him that much and it's relatively easy to manage with slow position change, just advising him, give it a couple more weeks and this will probably go away. Also ensure hydration is adequate. Let's take a look at option C. After starting the new medication, I feel like the room is spinning around me. This is, of course, not correct. This describes vertigo, where the patient feels stationary, but the room is moving. Vertigo is usually caused by an inner ear disturbance and can certainly be triggered by a number of causes. Meniere's disease and acute labyrinthitis are among the 2 more common diagnoses. And with initial onset of Meniere's or acute labyrinthitis, these folks are usually incredibly miserable. You might hear reports of vomiting. They often will not be able to sit upright in the exam room. And what we're hearing from this patient is being option B, the correct answer, a much milder set of symptoms. But the real point here is, remember, vertigo and lightheadedness or dizziness are entirely different things. And then option D, I've had chest pain and sweating off and on since I started the new medication. This, of course, is not correct and is a very worrisome scenario with concern about acute coronary syndrome symptoms being reported. In this scenario, it's unlikely that the thiazide diuretic initiation was the cause of the ACS symptoms. Whatever the trigger, a prompt clinical evaluation is required. Given that we're being told he's being seen in the primary care setting, if a patient presents with D, off to the emergency room with them. However, one more time, B is the best answer. About 2 days after I started the new medication, I started to feel lightheaded, when I stood up quickly. Key takeaway, knowing the common adverse effects for commonly prescribed medications is critical to safe and effective practice, as well as NP board success. Remember, this is a test to see if you will be a safe and effective clinician.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.